All right, so today we're going to talk about the measles because we're having more measles outbreaks in the U.S. because of decline in vaccinations. So it's important for us to be able to know the signs and symptoms of measles in order to recognize it, isolate appropriately, and treat appropriately. So the first thing we're going to talk about is signs and symptoms of the measles. The next thing we're going to talk about is spread of the disease, and then we're going to talk about proper isolation. Signs and symptoms. So 3 C's is the first thing, and that would be cough, coryza, which is nasal congestion, and conjunctivitis. Other signs and symptoms are malaise, fever, which can be up to like 104, 105, and a maculopapular rash that will show up kind of later in the disease, and Koplik spots. All right. So Koplik spots are white little spots inside the mouth, typically on top of the hard palate is where they're seen. These show up usually, I think, 4 days after the start of the illness, so those are pretty early. The rash doesn't show up until up to 14 days after the illness. So this may be at the end of the course where the rash shows up. That can be all over the body. It may not just be on the hands or the feet or, just the trunk. It could be all over, all right? Spread of the disease. It's spread by coughing, sneezing, so those droplets that hang in the air when we cough and sneeze, okay? It can be contagious for up to 4 days after the rash appears, so that's a total of a 21-day period where you can be contagious. So next we're going to talk about the end, how to prevent the spread of the disease, how to isolate appropriately. So yes, it is droplet because of sneezing, coughing, but because of its high risk of contagion, we isolate it airborne. So you need your negative pressure room, your N95 mask. If you're transporting a patient, the best thing to do is to put a surgical mask on the patient, and you should still use your N95. You can also use the PAP, or the positive airway pressure respirator, but we don't use those here. We use the N95 masks. If you're going to be transporting upstairs, anything like that, try and make sure it's an empty hallway. That's just best practice, and an empty elevator, if that's possible. So negative pressure room, empty elevator, N95. Also, if you are exposed to measles, you need to be quarantined for 21 days because that's that window of contagion for the disease. It's very contagious. About 9 out of 10 people who are closely exposed to measles will develop measles. So that's how contagious it is. If you have somebody who is sick, they are still contagious up to 4 days after their rash appears. Okay, so when you start to see that whole body rash for the measles, then make sure you know that 4 days after they're still contagious, okay? All right, so in conclusion, cough, coryza, conjunctivitis, 3 C's. Koplik spots, but those will come and also go very quickly, so it's not always, but during your HENT exam, if you have somebody that you suspect of the measles, if you look in there and you see Koplik spots, that's probably highly, highly likely that that's the measles. Okay? All right, that's it.